Hello, my name is Jacob Grove from the University of Kansas Medical Center in Kansas City, and I wanted to thank the Aesthetic Surgery Journal for allowing us to review our research in the upcoming December issue of ASJ, where we looked at the efficacy of deoxycholic acid, marketed under the brand name Kybella, for the treatment of submental preplatysmal adiposity. Our case series involved 13 patients enrolled in the study, where our outcomes were assessed both subjectively using the validated FaceQ assessment tool, as well as objective volume changes in the treatment area using the Vectra 3D camera. Our results did confirm that in all treated patients there was a significant volume reduction after treatment sessions had completed, as well as an improvement in the perceived aesthetics of the submental region for all patients. Interestingly, we did find that a majority of patients that we treated required at least 3 rounds of treatment in order for them to gain their own desired aesthetic endpoint, although the volume of product did decrease with each subsequent treatment session. Overall, the injections were well tolerated, although there was an underappreciated side effect in addition to the swelling that we're all aware of that came in the form of residual numbness in the treatment zone that lasted up to a month in some patients. However, the recovery time in general was shorter with progressive treatment sessions. Finally, in certain patient populations, specifically those older patients with poor skin elasticity, there was also a risk for deflation with overtreatment. Overall, we do feel that the technique is not overly complicated and can be picked up pretty quickly, although there was some accuracy required in terms of your needle depth with your injections. Anecdotally, we feel that results are certainly best in young patients that have isolated submental adiposity and good skin elasticity, and deciding on whether or not these patients would be appropriate for Kybella versus perhaps the gold standard of submental liposuction really is going to be based on a patient-by-patient specific basis. So we certainly look forward to larger sample sizes and for future studies, including our own, as well as weighing overall patient satisfaction with the relative cost for the procedure. Thank you.